am so delighted to meet you, Dr. Erin Troy. You have this beautiful backdrop to anybody watching on YouTube, Muller Veterinary Hospital, but it's really Erin Troy's Veterinary Hospital. You own it, which is a huge accomplishment.
Thank you.
I think owning your own clinic is a big uphill battle nowadays, and I think your patients are really lucky because the buck
Oh,
stops with you, so you take full responsibility. And
I do.
do you get 5 or 10 minutes off a week, or is it like not even?
On a good week. On a good week. It's helpful. It's helpful to love what you do, so that makes a
Yeah,
difference.
it does. I found you, as it turns out, because I was captivated by Synovetin OA, the injectable arthritis targeted drug, when I heard about it. And then I sat and met with one of the docs who was one of the creators, founders, what have you. And I don't know if you know this, but they've come on this show as a sponsor because we saw eye to eye about the fact that there's so many dogs in pain, undiagnosed, untreated, unnoticed. And then even if any of those things, noticed, treated, diagnosed, what have you got to give them? Pain meds, right? Or maybe an anti-inflammatory slash pain med. I would love to know your experience with Synovitin because I said, are there any vets who've really leaned into it? And they said, oh, yeah, Erin Troy, she's dealt with it
So
personally,
good.
professionally. She's one of our most ardent supporters. So, how did you come to learn about it? It's quite new in the field.
It is quite new. And the quick story is during COVID, one of my patients that I treat both in my general practice and my rehab practice had bad elbows. She was an older dog, double digits. We'd been trying a lot of different things. Mom came to me, well, through email because we were in COVID and
Right.
said, I found this new technology. It's down south. I'm thinking of pursuing it. What do you think? Quick and dirty research at it. I'm like, it's FDA approved. Let's get, what else do we have to lose? Because we are not winning this battle. So she went and was treated. She was a little bull terrier. She went and was treated. And the video they sent me 2 weeks later made my heart stop because she was
Oh,
so much
you
better.
gave me chills.
Yeah, it was really mind-blowing. And fast forward to the next year, I adopted a dog at 18 months of age who happened to have osteoarthritis at 18 months of age.
Ooh,
And
what
I
kind
didn't
of
know
dog? What kind of dog?
she's a Labrador
Isn't
retriever.
that a shame?
Yep. Didn't know it when I adopted her, but started to see the subtle signs suggesting she's not moving like she should be, and went through the whole process, the CT, the arthroscopy, started to do some injections. And I was just finding in that first 2 years with her that she'd have some great days, some good days, some not so good days. So then my mind flashed back to, oh, what did we
The
do
little
for
bull terrier.
Susie?
So when you say
And
you gave her some injections, do you mean Adequan? What were you doing?
good question. Yes, Adequan is part of in my toolbox, so I can consider this a toolbox that I have.
Right.
I was doing other joint injections. I was doing HA, hyaluronic acid joint
Yes.
injections. I was doing PRP joint injections, and all were helping, but they weren't long-lived. And I don't think I was getting the kind of relief I was looking for her. By that time, she was 3 years old. She was still a
A
puppy in her head.
youngster. Yeah.
Yeah. And so I reached out to the Exuberon people with Synovitin and started the process. They make the process super smooth. I had to get some education, had to learn how to be a radiation provider. And so went through that, which was pretty straightforward. And my dog, Verde, was the first dog we treated.
Wow. So you became your own guinea pig.
I did. I did. The
So
blessing and the curse of a veterinarian's dog.
that's right. That's right. You get to try everything, and oops, that one wasn't the right one. Not that you made a mistake, it just wasn't right for that
You
dog in
just
that
don't know.
moment. Just to back up for a second, vets or vet techs who are listening, is handling radiation scary? Is it dangerous? I know I'm playing devil's advocate. I know it
Love it.
could seem a little daunting, but it shouldn't be frightening and it's not dangerous, at least in the case of this drug.
I agree 100%. Knowing very little about it. My exposure to radiation was x-rays, as are most veterinarians and most vet techs, and we have all those precautions in hand. I don't believe this is more precautionary than x-rays are. I believe it's less precautionary. There's a few little nuances that you have to be mindful of, but it really did not scare me at all.
So anybody who has had a radioactive uptake test, I'm thinking of humans now, and the idea of radiation, the two things that I could relate Synovitin to are hyper T in cats. They get a radiation
Right?
treatment and they are radioactive and have to be kept in a kind of isolation because even their feces are radioactive,
Right,
which
right.
is
And that's not the
entirely different.
case.
That's a full body of radiation.
Entirely different because where we put this, it stays. It doesn't move throughout the body. I don't have to worry about blood test monitoring. I don't have to worry about where I feed her, where she potties, any of that stuff. There's a little distancing for a couple of weeks afterwards just to be precautious. But she slept next to her Labrador sister, slept on the foot of my bed as I read at night. So really the scary part that I thought might be there wasn't there at all.
So, to the vets and vet techs listening, you might think, oh, I have a lot of arthritic dog patients. And I have never put a permanent smile, if you will, on the owner's face. And I think
Yeah.
that is a challenge for vets. It's all we can do. Now, Scooby Doo, one of my rescued Weims, had elbow dysplasia that made him
Oh,
look like he had chicken wings. I mean, his elbows, yes, were sticking out from the side of his body. There was nothing we could do to help him. And in the end, we put him to sleep because life was just painful and there was
exactly.
nothing we could do. Now,
Exactly.
if Synovitin had existed and I adopted him at 6 months from a shelter, actually, directly from a shelter, some of the shelters back in the day, this was the early Southampton shelter, and somebody would tell somebody, "Oh yeah, Tracy's the Wyme person." They'd call up, "We got a Wyme came in." I'm like, "Uh-oh, I guess that's me." But
I
what
love
if I
it.
had noticed the way you did with your young lab, that this dog was not necessarily crippled yet, but definitely not moving? What would you have done? X-rays to see where to put the injection?
Yeah, we start with listening to their moms and dads, right? Because
Right,
they are the number one advocate for pets. Then, of course, we do a visual gait analysis. We watch how they're
right.
moving. I focus because I'm rehab trained, rehabilitation is part of my soul as well. I watch for transitions. How do they get up? How do they get
Yes,
down? And
yes,
then I palpate them because dogs are so honest. And when you go to palpate them, if there's an uncomfortable place, it doesn't matter how stoic they are, you're going to be able to detect it. Then on to x-rays, we get the diagnosis, and then we talk about treatments. And early in the disease, the better, because
right.
synovitin is disease modifying. Synovitin can slow down the progression of this disease. And that's revolutionary.
Yeah, it is because you aren't just helping the joint, you're protecting the joint against the future damage
Absolutely.
of the
You're
disease.
absolutely right.
Now, is it true, or maybe I did ask this of Dr. Synovitin, Dr. Bob, but did you know that in Germany they use this on people?
So I have read that.
I'm so curious about it. I luckily
as am
had to have a knee, luckily, if you will, had to have a knee replaced. But what if I'd been able to get a Synovitin injection in that knee? Wouldn't
right.
that have been cool?
This is the first time in my world as a veterinarian that our pets are ahead of our people in the United
Yes,
States when it
yes.
comes to managing this. And as a veterinarian and a dog mom, I am all for it. I am good with that.
Yeah, because it does affect all dogs eventually. Larger
Yes.
dogs more so. Your little bull terrier was that a little unusual? Oh, that was already an older dog.
She was an older dog when we diagnosed her. Yeah.
Now, when your human patient said to you, "I'm going to go down south," what does that mean? Did somebody in Georgia have the ability to do it, or what was that all about?
She went south of where we are, was one of the earlier adopters of Synovitin OA in California. So I'm in the Bay Area of California. There was an earlier adopter of Synovitin that she had found on a website
Oh.
somewhere. And so they were able to provide her with the technology, the device at the time. And that, again, that was the genesis for our process.
So, are you a tribe? Is it a tribe of docs who are like, we're the Synovitan docs? Because you are sprinkled, either accidentally or purposefully by the company, around the country. So, theoretically, within 2 hours of anyone, unless they live on a mountaintop in, I don't know where there are mountaintops that are 2 hours from civilization,
Right, something.
but, right? Which is not a bad choice nowadays as a
No,
place to
not at
live.
all
So,
these
call it
days.
3 hours or four. But are you all in some way connected or is it really random?
I think it starts out a little bit random, except we do network. Those of us that are either involved in orthopedics, physical medicine, rehab, sports
Yes.
medicine, or pain management, We kind of network through listservs and we hear about things and we communicate with things. The internet makes it so much easier to do it in real
Right.
time than having to wait till you go to a meeting. So while I'd love to say we all have a Synovetin tattoo on the back of our head, not yet anyway, we do definitely network with each other.
So, since PT and rehab are a subspecialty for a veterinarian, and you have that in addition to the other hats you wear, is this a modality that the PT docs know about? Are they espousing it for their patients, or they're just saying, get on the treadmill, get on the underwater treadmill, this will all work out? Because those of us who've been there with older dogs, it's like, it doesn't really work out. It helps a little bit for a little while, maybe.
I think one of the things that the physical medicine or what we call rehabilitation medicine, sports medicine people, and the pain management people have in common is their openness to a multimodal approach to treat. And we think outside the box. If this doesn't work, then move on, then find something that does, or layer something new on top of it. And that's where I think Synovetin has become so valuable to us.
So for the patients after your own dog, did your own lab have a great reaction?
She did. She had an amazing reaction. She came off all medications for the first 11 months after her injection, started back in because she had done something silly, big diving leap
Yes.
off the bed. She started back on meds for about a month and a half to 2 months, and then I could get her off of them again. And she was about 18 months post first injection when I treated her the second time.
So
And
it not only lasts for about a year, it could last a year and a half. And
with
then if your
some,
dog does some injury to themselves in the meantime, it's not going to prevent the injury from causing pain, but the joint
correct,
is not continuously deteriorating.
correct,
So which
correct.
of her joints did you address? Both of her elbows or
Yes,
hips?
both of her elbows.
That was it.
Yeah, yeah.
So, someone to know where the injection would go, if they see their dog, as you say, that transition is the big tip off. How hard is it for your dog to get up from lying down?
When
Or
she's sore, it's very
that's
obviously
right.
she struggles. When she's not sore, she pops up.
So, for people whose dog is having that hard time and it's quite awkward and it takes a bit to get the hind end underneath them and the front end to go forward,
Mhm.
where on that dog would an injection go? I understand you have to do physical, visual, and palpate and x rays, but where would the place be? It's not the vertebrae, right? Is it the hind end that goes first?
Correct. So it depends. And I think the thing people don't always realize is they think their dogs are not in pain if they're not whining or they're not limping.
Yeah.
My dog neither whined nor limped because both her elbows hurt at the same time. So she couldn't figure out which one to limp on. So
Wow.
she just changed how she got up. So
Mhm.
once I watched her move and palpated her, I could tell. But it's usually the joints that I'm injecting right now are usually either the elbows or the knees right now.
The knees, the
And
front
the
knee,
back legs,
the
back leg,
back knee.
back knee.
What I think of as a hock on a horse.
So think higher. So think the joint that has the cruciate ligament injury.
Yes.
That's the joint.
I think of that as the hock. Is that not the right word? If it
That's
were,
the stifle.
oh, that's
Yeah.
the stifle. Okay, never mind. We know it's a dog, it's not a horse. Never mind. Forget that I even brought that up. It's just that I lived with a lot of performance horses who were getting adequate injections, which weren't very effective. This is not to disadequate. I had Jazzy was on Adequan constantly, monthly for years, and I guess it kept her somewhat out of pain. That's what there was. But
Right.
it was always a constant vet visit and a constant injection and a constant wondering, is it making any difference? Or you could say, I don't know, would it be worse without it? That's not really the great yardstick.
But it's what we ask ourselves, isn't it?
That's right.
Sometimes, especially when you have a patient that can't speak and talk to you about their pain level, a lot of what we do is observing and,
Yeah.
again, the art to the science.
So, how many dogs would you guess you've treated off the
Oh
top of your
gosh,
head?
30,
Wow.
30. I think we're almost to that since we've been
A-
doing it.
And how many of them have had eureka moments? Hallelujah.
At least half have had eureka moments. And of the other half, because they either had other diseases,
Oh,
a lot
right.
of them had shoulder issues as well, they were better. Every one of them, I can honestly say to you, every pet I injected improved. It was to what degree? And a
Right.
lot of that has to do if they have concurrent injuries.
or how old they are when you start, and what else has been done for them in the meantime. Did you consider all of those human patients more vigilant or observant than others?
Oh, that's an interesting question. I really think, I don't know if it was more than others or earlier in the process than others, or some of them came to me from having tried a lot of other options. I consider them to be very dedicated and
Yeah.
they were really determined, but definitely observant. They definitely could tell when things were not good versus when they were good.
So do you, given the hats you wear, do you sometimes go by people jogging with a dog in the heat on the cement and want to pull your car over and go, please stop, I'll pay you anything. Put that
Oh, yes,
dog in the back of an air-conditioned car and go home, lady or man.
ma'am. Yes,
Yeah.
ma'am. I fight that urge on all dog lovers do. You don't have to be a veterinarian to do that. It's a toughie, isn't it?
Well, I wish that all dog lovers felt that way because the people jogging are dog lovers. They're just dog dummies.
Yes.
Really, they love their dog and they think their dog loves running in the heat on cement, and they're 8 years old and their joints hurt before you started out.
Absolutely. You're
Yeah.
absolutely right.
It's not like the run was the problem. The run just put a little fuel on the fire.
Absolutely.
So, what would you recommend as the starting point to see if somebody is a candidate for Synovetin, just to people anywhere listening, or
Sure.
to vets, also to vets and vet techs? When do you start to recommend that as a possibility? And is there ever pushback? Oh, you're just trying to make a buck.
Good question. I think both of those are really good questions. I think recognizing that dogs can get arthritis as young as 18 months of age is important because when families see a change in their dog's movement, they might just automatically dismiss it can't be something serious. It can't be
Absolutely, I
arthritis. They're
would.
too young.
I would. I
Like,
think, oh, it's osteosarcoma. Dog must have a bone tumor because it's impossible to have osteoarthritis at 18 months.
right.
Or they must have pulled something, you know.
Soft tissue injury.
Yeah, they got, I don't know, a hamstring or whatever a
Right.
dog can get this the
Right.
equivalent, and they'll be fine. But then they aren't
Right.
really fine because it was their bones and their joints.
Joints. And I think being your dog's advocate and having a good relationship with your vet, I think having that conversation with your vet and saying, I want to be proactive, doc. I want to know if there's arthritis
Yeah,
developing early. That's a huge component of it. And then once you get a diagnosis, then the vet reaching out and figuring out what are all the options. Meds are an option. They're absolutely an option. Are they the only option? No. That multimodal approach and using a medical device like Synovetin OA early, that one and done kind of impact, and knowing that you're going to make an impact not only in making your dog's pain less, but making the joint slow down in the disease
right.
process.
Which would be
Huge.
very nice for people too.
Yeah,
I mean,
wouldn't it?
arthritis is devastating for people. God knows
Yeah.
Advil probably would go off the market if arthritis was cured. I don't
I,
know. I'm only kidding. But I mean, how
both
many
of them.
people live on ibuprofen or one of the equivalents and they're burning
Absolutely.
up their guts? Speaking of which, these pain meds that people put their dogs on have a downside. They have risks
Yes.
to other organs. So can we talk about that for a minute? Because it seems to me that Synovitin is that very rare intervention without a side effect, without a downside.
I agree. The oral medications, as effective as they are at doing what they do, there's a risk. You've got to watch their liver, their kidney values, and you've got GI upset. There's no blood test monitoring with Synovitin OA. There's a little light sedation, and true, they are uncomfortable for a day or two after a joint
Oh, that's
injection.
interesting. It
So
makes them
you've
achy.
it does make them achy, and we're really proactive with counseling the families ahead of time and making sure they've got maybe advanced pain meds for a few days,
Nice.
making sure they don't ask too much of their dog. And within the first 4 weeks or so, you will see a noticeable improvement. We think the maximum improvement starts around 4 weeks. 5 weeks, you start to go, okay, this is where we're going to be. And then you get the chance to watch them get their joy back. It's
That's
just,
pretty cool.
it is.
So, again, to use a brand name just because these inventions, if you will, are rare, and you can't just generally say a drug like Librela.
Right.
But Librela was the magic bullet. And when you got this injection, which the dog had to get monthly, and this is anecdotal from me personally, but just hearing around, it was eureka right away, which set up a very high expectation that,
Absolutely.
oh, it'll just always be like this, and or after every injection monthly, it'll be like this. Did you use it before you used Synovetin?
Let me answer that question. Yes. But we got them in at kind of at the same time.
Oh,
I'm a late adopter about some things that I don't have a lot of data on. And I was enthusiastic about Librela, but I did a lot of research and I realized that unlike Synovetin, it works pain only. It blocks a pain receptor only,
yes.
and it blocks just one pain receptor. And without knowing exactly whether that pain receptor is
Oh,
causing the dog's problem, you
oh,
don't know if it's going to help or not, but it's worth a try. But it's not going to change the health of the joint.
interesting. And it's not
And
into the
that's
joint.
not into the joint. And there are some side effects associated with it. We've all learned those. There are some dogs where it has been a miracle drug. There are other dogs where they've had a minimal response. And there have been some dogs that have had a negative response.
Hmm.
And like you said, you've got to keep coming back to the vet month after month.
And you may
So
not get the same response each time. You might
you
get great,
absolutely may
and you
not.
might get neutral, and you might get bad, because it's interesting about the pain receptor. So, do you mean a pain receptor in the dog's brain or
I
in the
don't.
nerves?
It actually goes into the receptor for Librela is inside the joint. It's on the joint capsule. And so if that's where the pain is, it blocks that pain pathway to the brain. So it doesn't go to the brain, but it goes to the source of the pain. But what if your dog or my dog, their pain isn't from that particular receptor? Then
Uh,
you won't get the same response.
and could a dog's pain receptor change over time?
They absolutely, not only can
Wow.
they do
So
change
it's a
over time.
little bit of a moving target whack-a-mole.
I
It's
love
not like
that.
all pain is pain.
That's a perfect description, whack-a-mole. You are exactly right. Yep.
So it's a little bit, it's not really playing darts with a blindfold, but
Yeah, again, because we don't have patients that speak to us. So your
right,
doctor or my doctor may ask us some specific things, but I look at pain as something like an 11-lane highway going from the sore joint to the brain. And which one of those lanes of pain am I going to block with what product? And oh, by the way, is that even going to work in this patient today?
right.
So it does vary. I think the whack-a-mole analogy is actually a very good one.
So it's nice that you have this tool in your toolbox, which does involve an extensive exam, some somewhat costly tests. X-rays aren't super pricey, but it involves some outlay of money up front,
Yeah.
and then the injection itself, which could be once a year, once every 18 months. Yet again, folks, may I say health insurance for your dog.
Yes.
Because if you, Dr. Erin Troy, adopt an 18-month-old dog, someone's reject, we just have to say that because we've all taken in those dogs who seem like, wow, why would somebody want to give up this little
This
beauty?
one.
You get the pet health insurance immediately, and if they have no documented health history of whatever the issue may be, then health insurance will cover it.
Correct. It does.
So I don't know the cost of Synovetin OA, and obviously it's going to be different where you are, or in Ohio, or where I am in Vermont, or I think the
Right.
nearest one to me is in New Hampshire. But it would be nice to know that you have that coverage because osteoarthritis is staring down the tunnel at all of us. So every dog is at risk, a high risk of developing it.
Absolutely. And again, all of these other tools we use, like you mentioned, Librela and the medications, they don't have that disease modifying effect.
Right.
So you get a double whammy with this because you get them more comfortable and the disease joints age better.
So a vet could be happy that they have such a good result and a much happier dog and a happier patient, but you have more time to book other people. That is to say, it's not a cash cow for you. I don't
Yeah.
mean that in a crass way, but it's not this one will keep coming back. You get it right. It's bye. See you in a year for your annual exam.
Yeah.
So, I
It's
mean,
an
that's
interesting way to look at it, but you're not wrong.
because people sometimes have this ridiculous attitude about vets, which I have yet to understand. Who at the dentist says, you're just trying to make money on me with that implant? No one says that. But with vets, are like, yeah, they're just trying to make money taking a test. Well, we know that's not the case. You are all there for the as a passion project. And if you can keep the lights on and the building warmer cool, that's a big accomplishment
Yes,
nowadays.
ma'am. Keep my staff happy. That's important.
Exactly, exactly. Erin Troy, it's so great to meet you.
And
And
you.
I hope that other doctors listening will really reach out to you and to Synovetin and Exubrion and find out more about it because this is obviously something that every dog and dog owner deserves a chance to explore. Thank you so
Absolutely.
much, Erin. It's great to meet you.
Thank
I
you, and you,
have a
Tracy.
feeling you'll be back on the show. I have many other things I want to pick your brain about, and it's
Love it.
a
I love it.
lively brain. Thank you so much.
Appreciate you. Thank you.